Well, good evening. Thank you all for being here. I'm Kathy McCarthy, Chief Operating Officer for the Texas Academy of Family Physicians. Thank you for joining us for our second of 3 social media webinars. If you missed the first one, there's a recording of it on our website. Tonight, our speaker will focus on using social media for marketing, advocacy, and patient care. Dr. Mike Sevilla is a family physician and has cared for patients in Salem, Ohio for more than 20 years. He's been involved with the Ohio AAFP, recently serving as president, and with the AAFP, where he served on the AAFP Commission on Membership and Member Services. He began creating social media content back in 2005 and shares his experience teaching social media literacy to fellow family physicians, residents, medical students, and others. In addition to his work on social media, he contributes to traditional media with articles and various publications and segments on his local news. You can see his contributions on his website, drmikesevilla.com. The chat feature is enabled, so you can communicate with each other or with me, and please use the Q&A feature to post your questions. We'll have time at the end for questions. With that, I'm going to turn it over to Dr. Sevilla.
Thank you, Kathy, and thanks everybody for joining me for the first one, and welcome to those who have come back here. So this is always the fun part, to share my screen and get going here. So, all right. So as Kathy said, I was born and raised here in Ohio, and I've been practicing here for about 20 years now. And so tonight's session, we're going to be talking about, tips and tricks that you can do in social media. And I always try to, gauge my talks for, a variety of skill levels. Some of you are just starting out, some of you are curious, some of you are advanced learners in social media. So I try to tailor my talk to a lot of different levels. And of course, I always have, we'll have time at the end for questions. Please plop those into the Q&A. And as I started with my last one, I'm going to start just with some current events in social media and in digital media in general. What's really one of the things that's really hit the mainstream press, is Twitter and the purchase of Twitter, what that is all going to mean. It's something really interesting, especially those of you who are on Twitter, how that's going to affect you. And another thing, is social media in elections, not only in this country, but my parents are from the Philippines. And it was interesting reading this article on how social media is going to be influencing the elections in the Philippines this year. So it's not just in this country, digital media, social media is affecting a lot of things in the world. And no matter what side you are on, as far as the abortion issue, everybody has seen, or I have seen, a lot of stories being shared on both sides of this issue, in traditional media, in social media, people trying to get their voices heard, no matter what side of the issue that you're on. So it's kind of a traditional media, social media discussion, which is interesting to monitor. On a lighter note, people who, even people, the casual person, probably heard about the Kentucky Derby over last weekend, and how this horse and jockey out of nowhere won the whole thing. So it was interesting kind of seeing how social media kind of blew up on discussion of this upset in sports. And even in the past few days, you've seen probably in traditional media and social media, you heard of this passenger in Florida who had no idea how to fly a plane, was able to land a plane without too much difficulty. So it's interesting, obviously, social media is a lot of kind of maybe like water cooler talk, but the topics can vary, and your involvement in social media, if you know about these stories through that, social media is really kind of making an impact on how we get news and where we get news. So for people who weren't able to join the first webinar session, so this is where I practice. I practice in a small town in northeastern Ohio. It's called Salem, Ohio. And I'm in a group with 3 other family docs and 1 nurse practitioner. We are completely independent. We're not owned by any kind of hospital or hospital system. We still see patients in our local hospital, which is across the street from our office. We see patients at a local nursing home. Before our hospital stopped doing OB, we would see newborns in the nursery. Now, we still go into the hospital. We see our ICU patients. We do have a hospitalist service at our hospital, but our practice feels strongly about seeing our own patients in the hospital. So unfortunately, it's kind of called more like traditional family medicine, but this is the family medicine that I wanted to practice, and I'm still practicing, and I'm still practicing the medicine that I started medical school visualizing. So very lucky with where I'm at here. And as I said with the first webinar, this is kind of my one claim to fame. I was on the cover of Medical Economics, and this is all the way back in 2010, really when there was not really much talked about as far as physicians and social media. I started dabbling a little bit in social media kind of around 2005, 2006. This was even before Facebook was widely known. This was before Twitter even started. And kind of my story in a nutshell is that I was really frustrated seeing all the negativity that was out there. Obviously, it's still out there now, but back then it was really directed at the MMR vaccine, if you can remember all the way back then. And on social media, if you would Google anything, it would be MMR vaccine causes autism, and which we know is false now. But there was no really kind of physician voice out there. It was only celebrities out there on social media, and me and kind of a lot of physician social media champions from that time. We thought it was kind of our mission to kind of correct the misinformation, which wasn't even known as misinformation back then. It was just bad information. And then that's one of the reasons that drives me, that really kind of drives me to share that social media really can be used for positive things and not really for negative things. And that's kind of part of the reason why I do what I do on social media. Now, as I talked about it in my last webinar, we could talk about any of a variety of social media platforms, including things like, TikTok and Instagram and all of that. And where I'm going to direct kind of my comments is Facebook, because Facebook is still the most popular, the most commonly used social media platform, is probably the most popular social media platform of your patients. So those of you who are not doing anything or who are doing very little on social media, I would, kind of focus on, one platform, and that would be Facebook. That's where you can get kind of the most bang for your buck as far as for your time and for the type of information. I know all of us as busy family physicians, you're not as crazy as me and have time to visit all the social media platforms out there. But to get the most kind of bang for your buck, I would focus on Facebook for your clinic, for your office. And also, as I talked about previously, if you do work for somebody, if you're employed for somebody, definitely check out and make sure that what is the social media policy for the person that you're working for, whether it's your corporation or your hospital system or whatever. If you don't have a social media policy, I'd be happy to talk more about that later, but you definitely need to kind of develop one because there's been a lot of problems that have come up. I'm going to cough here, excuse me. To address things like, what happens if, one employee talks about another employee on social media? How is that dealt with? How is that dealt with your office staff or your hospital? So a little bit outside what we're talking about today, but definitely something that you should think about if you're not doing anything with social media at this point. So just going to start out just with some general social media tips for success. I shared some of these in the previous webinar, but I'm just going to review those for people, especially who weren't able to catch the first webinar. The first tip is to be authentic. Oh, excuse me. And you'll see on the slide here, you'll see that there's a tweet from AAFP. There's a tweet from our family physician colleague who's getting her first COVID vaccine. So when you're authentic and you share that out there on social media, your patients and your community can really connect with you a little bit better. When they see your face, they see what you're doing out there. That generates a lot of authentic type of feelings with the person you're connecting. Now, there's a lot of talk about personal brand. That's a little bit of a complicated type of topic, but just trying to simplify it down. Be engaging, and active. It's good to share other people's content, but it's even better and you connect better with your audience when you develop some of your own content. And it doesn't have to be very complicated. It could just be, hey, we have our flu shots here at our office. Get that out there, or take a picture of yourself, at work. People really enjoy kind of the behind the scenes of what their doctor's office is doing. As I said before, prioritize 1 or 2 social media channels. Here they talked about Twitter, LinkedIn. I'm advocating more if you're not doing much. Facebook is where you're going to get more bang for your buck. And share your stories of your events. I know some doctors' offices, if they feel comfortable, they share, some of the social events that are happening, with their office, like if they're out at a playing kind of like a softball game, if they're doing outreach in their community, they share that on their social media channels as well, just to let your patients know, hey, not only are we working here in our office, we are part of our community, and we want to be part of our community. And social media dues, I'm not going to dwell too much on this. I'm just going to kind of glance through this list here. Identify yourself and speak in the first person, and never be anonymous on social media, because people will find out, who you are and all of that. So that again lends to the authenticity as far as on social media. Take responsibility and follow your institutional guidelines, meaning like your social media policy. Respect copyright, HIPAA and privacy laws, stay up to date on current events, add value, be accurate. And when I say be accurate, we've all had these kind of confusing, CDC guidelines that we've had to go back and forth on during this COVID pandemic. And so definitely be sure of what you're talking about, especially on social media, because people will call you out on that. Get to know your fellow social media users, use good judgment, be professional, and of course, have fun and learn. And of course, there is social media professionalism as well, which is also being taught, to learners, to medical students, to residents. Well, what does it mean to professionalism in social media? So the bulk of this talk here tonight is just going to be, these are the topics that I'm going to be really focusing on. Tips for patient care, marketing, and advocacy. And it's kind of a little bit of a social media progression. So some of you may find yourself here at step 1, or some of you may find yourself progressing down to steps 3 and 4. But briefly, just kind of outlining this slide, step one, if you're just kind of curious about social media, you're probably doing these things right now. You're probably, liking a picture or liking content or leaving a comment on a photo or on an article, or you're sharing something that you're seeing out there on Facebook, for example. The next step is you yourself or somebody in your office, posting something on Facebook or Twitter or something like that. It could be, words. It could be like, hey, don't forget to, think about getting your booster shot, or, we're starting to do our, summer camp physicals for scout camp or something like that, putting that on your professional page, or sharing photos saying, hey, it's finally springtime here in Ohio. The next step is is sharing articles. And if you're like me, kind of a news hound, really following what's happening day to day, maybe even locally in your community, but also nationally as far as the national conversation of what's going on, sharing those type of articles on your social media feed. And then later in this presentation, I'm going to show you the power of video, and why video is a very powerful storyteller. It's a very powerful way to share kind of what's going on in your community, or to share a powerful message. And these can be used by things like Facebook Live or other live video platforms. And the last thing I'm going to talk about is, we need you. We need you for family medicine advocacy. We see, and you see out there, there's a lot of people that are, taking shots, at primary care, at family medicine, or if you're a medical student out there saying, you're too smart for family medicine, you're too dumb for family medicine. We as family medicine physicians and trainees in family medicine, we really need to stand up for our specialty and for what we do. So starting out here, like, comment, and share. A lot of you are doing this now. That's kind of the first step as far as, seeing what the power of social media is. You see something out there, you thumbs up, you thumbs down, you love, you say, oh, that's crazy. And then share it with the people in your network, and then also comment. So that's kind of the first step as far as getting involved with social media. The next thing is, sharing, words out there. And I share this slide as a joke. This is a friend of mine. Today is World Naked Gardening Day, and I think my neighbors are upset. Ha ha ha. But there's a lot of things that you can do with this. I mean, I've seen people across the country. Sometimes there's something that's very, very local to your community. I remember, that there was a meningitis outbreak here locally here, and all of the local resources here were trying to come together to try to get the right information out there. Or you hear a lot of things about different infectious diseases, hepatitis, or something that happens on college campuses. So that's something that you can kind of, use your social media for. Of course, I said this before, if you're in an office, say, hey, our flu shots are in, or our flu shots are coming. Or, we just got another set of pneumonia vaccines or something like that. That is something that is directly that you can put on social media to help your community and your patients know what's happening. And another thing that I do, with my own Facebook feed and my own social media feed, is to kind of share what's going on in my community. And you'll see on this slide here, I got this from our local hospital. A lot of communities around the country take part in, National Prescription Drug Take Back Day, which happens various times through the year. And, sometimes, other resources in your community, like your local law enforcement or your local hospital, they put resources out there that you don't have to type up yourself. You just have to hit share and let your patients know that this is coming. And of course, it gives me the idea too, to remind my patients in person when I'm seeing them that week, hey, do you have your prescription medications that you want to get rid of? You can just come to the hospital on Saturday from 10 to 2. So another way to share what's going on in your community. And for those of you who go to AEFP meetings or even meetings in general, I like to share, if I'm not home or if I'm with colleagues or I'm at a conference. This was at the recent AEFP leadership conference. So I shared a photo that I was there. You share your badge, you share what's going on there. It really kind of gives your way of communicating to people back home, especially your patients back home. Hey, I'm not on a vacation. I'm here, networking. I'm here learning what's going on as far as current legislative events nationally. So that helps you keep connected with what's going on. And I know it's hard to see, but you'll see in the lower left corner that 584 people were reached by this. So you kind of think in your head, how can you get the word out on important issues that you want to get out to your community? And at the beginning of this month, we had our primary election here in Ohio, and I always like to share out, that I do vote, and I think it's important that my patients vote. I think it's important that our families vote, and I share that on my social media as well. Just to show that you are part of the community. And another thing that I do on my page here is to kind of, I share articles myself about things that are going on in the community and things that are going around in my state. You'll see from this slide here is that down at Ohio State, unfortunately, there were a couple of college students who recently passed away because they had, drugs that were laced with fentanyl. So I share things like this to raise awareness for people in my community, and also to, if for anything else, maybe start to have a conversation, with those students, with adolescents, with college students that you don't see in your office that much. Hey, this is what is going on. There can be some really bad consequences from this, and you can use social media to start that conversation. So for these next few slides here, I'm going to talk about, the power of using video in social media. And a lot of people say, hey, Mike, I don't have time to do video. It's really time consuming. You need the right equipment. You need this, you need that. You don't really need that. With a lot of things, especially like with the smartphones, with the cell phones that we have now, you can just hit live and you're there, and it automatically, posts to Facebook. And you can think in your mind, like when you see these stories and you watch these stories on social media, people that do them very well, it really resonates in your head. I shared a couple of videos in my previous webinar. I would encourage you to check that out. But with these next couple of videos here, I'm going to show you kind of what really can be done as far as a communication tool on social media using video. Let me get a little drink here. So the first story I'm going to share with you, I'm going to take you back to 2017, to August of 2017, Hurricane Harvey. And obviously, that impacted a lot more communities in Texas than here in Ohio. But think about, what you were doing back then. Think about, if you were impacted or if you known people who were impacted. And all the way up here in Ohio, back at that time, I was following the news and I was following what was happening there. And I saw a friend of mine who was posting video of what was happening with the water level where he lives in the Houston area. And I was very curious about this because I'm like, well, why is he doing this? What is the message that he is trying to convey, not only to his local community, but maybe to people nationally and internationally? And it's one of your leaders from the Texas chapter, Troy Fessinger. I reached out to him right around that time, when the storm kind of, reached landfall and reached where he was at. And I was curious whether he was able to kind of share what was happening at his home, in his community, and what was happening there. And he graciously said, yeah, he would want to share his story on social media. And what I'm going to show you is a very small snippet of, I think, was maybe of an hour that we talked, and you can see and you'll be able to hear him. And you can see, I think he was having a lot of difficulty with electricity and power, but he was able to share a little bit of his story with everybody on Facebook Live. So I'm going to share this little piece, and we'll see kind of, what really social media storytelling can be all about.
So it just kept pushing more and more rain our way, dumping more and more rain our way. And that really became the huge issue. You see the stats on TV, probably everyone's seen them, but we've gotten more rain in one storm than we average in a year. And it's the biggest storm I or anyone else can remember in terms of rainfall. And people I know who were here during Tropical Storm Allison, that flooded Houston, created dramatic images on TV, killed a fair number of people. This was bigger and dumped more rain. And that's mind-boggling, because I remember the images of freeways underwater with semis floating, and this is a worse storm. So if you flash forward to flood control, to make it simple, if you dialed the clock back to before Houston was settled, this was a swamp. And the swamp filled up with water, the bayous drained it out to Galveston Bay. As people settled and we developed the area, the bayous were preserved, but turned into flood control channels. Houston keeps growing and growing and really takes off after World War II. And now we're at the size that I mentioned, and we sprawl over almost the entire county. So Houston has a reputation well earned for being a very wide, broad city. So you take all these bayous that were turned into flood channels in the 50s. You have reservoirs west of town that were built in the 40s. And then you dump a year of rain in 3 days on that system, and it just overloaded it. And the story of my neighborhood, we live a quarter mile off what's called Brays Bayou, which runs basically west to east through our neighborhood and out to Galveston Bay. It's set up as a flood control channel. 99% of the time, it's 2 feet deep. It has a really nice green belt along it. You walk, you jog. It's an attractive place to go exercise, and why a lot of people come to the area. Then you dump all this rain, and we're draining not just our neighborhood, we're draining 168,000 people who live in the watershed of this bayou. That was really our problem. It's not what's dumped on our neighborhood, it's that we're getting everything dumped in that whole watershed that's got to go through our neighborhood to get to the Gulf. And you multiply that by all the bayous in Houston. There's 5 or 6 major bayous. Every single one works the same way as flood control, but you dump enough rain on it, you fill up the reservoirs, fill up the retention basins, and the water's got to go somewhere.
So you think about that and you think, there's no other way to get that story out. You can't really do it with photos. You can't really do it with articles. The best way is kind of a first person account on what's really happening on the ground there. And you can see the full video at my website. And, not only was it really interesting hearing it from the first person account from somebody who's there. It was the response that happened after that. The Texas chapter really, reached out to him, reach out to people in your state And, there's a lot of people, around the country that responded to that disaster, as family docs do. But it's just another way that social media really can share the stories of people in our community, of family docs. And that's one of the only ways that is to do that is with social media. So, so thanks again for Troy for sharing his story, and thanks to the Texas chapter for everything that they've done, especially not during that weather event, but for events since then to help the people of Texas. To lighten things up a little bit, so what things that we do here in Ohio as far as Facebook Live and sharing stories is our state chapter. We do interview shows with family docs, and it's on our state website there. And we try to do it kind of on a semi-regular basis, and we've been doing this maybe for a couple of years now, especially during the pandemic. And we've had some success, and we've had some people who watch. It kind of grows with each episode, so we've been very happy with that. And the people that we've been able to interview are my friend Gary Leroy from Dayton, Ohio, who was AFP president at that time, and we had a nice conversation about what was going on with the academy, especially during COVID, which was during a lot of his presidency. So we were able to share kind of what the AFP was doing to help update members, to help members in other facets and capacities. And this was a recent one that we did, and these are all graduating medical students that we found in various schools in Ohio. And we kind of had a post-match type of interview session, and they were able to share kind of their interview process, where they're going, and advice that they had for upcoming medical school seniors about advice on the interview process. So that was fun to do. And then it was either this year or last year, we highlighted underrepresented groups here in Ohio. This was, I believe, during February, during Black History Month, to highlight not only medical students, but also faculty and residents to share their stories and why they believe that family medicine is so important, is the best specialty anywhere. And on a fun type of note, I also share some of my personal journey, and I've kind of developed a little bit of a mini series on my Facebook page, what I call Take a Hike with Dr. Mike. And it's a way for me to get out and to explore some of the communities around where I live. My patients and people in the community always give me suggestions, so that's great engagement with them. And you'll see that here, this is earlier this year, where there's still snow on the ground. And you'll see on this slide here at the bottom, Facebook now has, automatic captions that they put on there. And there's been studies done that, people pay attention to videos where there are captions, not just the person talking. So I think that's interesting. And I'm going to share just a little bit of this snippet here from February of me hiking around in the snow.
Hey everybody, welcome back to Take a Hike with Dr. Mike. I am, of course, Dr. Mike. And I know what you're saying, it's February in Ohio, what are you doing hiking? Well, we're here in beautiful Youngstown, Ohio. It is 45 degrees in mid-February, and we're hiking here, and you can see all the snow around me. But we went down to the water. I have some video to share with you. The coolest thing that we saw today, we saw some icicles coming down from the tree branches. It's the only thing that you'll be able to see in the wintertime as opposed to the summertime. Very cool stuff. So it's going to be warm around here soon. I encourage you to get outside. Of course, be careful. It is a little bit slippery and icy, but enjoy nature in the wintertime here in Ohio. I hope you're having a great weekend. And yes, there'll be more hiking coming up this year. Happy 2022.
So that was our that was my wife and our niece. So an interesting kind of addition to this is that so my patients keep me accountable now, which is kind of funny. So they say, "Hey, Dr. Mike, where's the videos? Where's the you got to get out. You work too much. You got to get out and hike. We want to see you get out there." So this has been kind of a fun type of project, just to kind of highlight the areas in our local community, and also my patients keeping me accountable to get out there and enjoy nature. So this last part of the talk here, so I really want to make a push for family medicine advocacy. We need you. We need you to help get the word about family medicine and about our values. And because if we as family docs don't do it, then no one's going to be able to do it for us. So just a brief thing here about COVID vaccination. If people aren't familiar with the This Is Our Shot campaign movement, you can just Google it. And one of our family medicine colleagues from California was part of the originating group of physician leaders for this. If you haven't heard about this, this is something really promoting COVID vaccination, trying to battle all of the misinformation that is out there. And you can see here that it's been really kind of growing. So 15 organizers. They have many organizational partners, including the American Academy of Family Physicians, along with a lot of other organizations. And you can see that, 1.3 billion digital impressions, which is a huge impact out there on social media to get the word out on COVID vaccination. The important thing on this slide is you'll see on the upper left, 8 and 10 say they'll turn to doctors, nurses, and other health providers when deciding whether they get the COVID-19 vaccination. So we as family physicians, we as family docs have a huge influence with our patients to give them the right information, to answer their questions, to try to cut through the myths, try to cut through the misinformation that is out there. So we need family docs really to help carry this message. These next few slides, I'm going to share a little bit of a personal story for me. And you'll see on this headline here, at the peak of the pandemic, healthcare workers were heroes, but now they're getting threats. And this really had a really big impact on me. It had a really big impact on me locally here. Our practice still sees patients in the hospital in addition to our office. And there was a time, and people have seen this who take care of COVID patients or in COVID communities, that there was a really, a switch that was around, in the early 2020s or at the beginning of this pandemic. A lot of healthcare workers were seen as heroes. But then, as 2020 went along, or 2021 came along, or 2022 came along, there was a real change in the attitude of communities. And that was really, really frustrating to me. So what I did is I voiced my frustrations with this. And I wrote a Facebook post about this. That's me taking a photo in our hospital. And, basically, I wanted to give a shout out to small towns like mine, small hospitals like mine, to kind of paraphrase this essay, just like, I'm saying that, the big hospitals like Cleveland Clinic, which is the big hospital system around here, they're getting all the glory, while small hospitals like mine are really seeing, a lot of frustration, a lot of anger. And what happened to that appreciation to the medical community that just kind of turned on a dime? And one of the phrases that I put in here is what I saw in the health in the restaurant industry. Everyone is short staffed. Be kind to those who show up for work. So this essay really resonated. And you'll see on this slide here, you'll see on the lower left, it's probably hard to see, but that this post reached 14,342 people. And there were over 3,000 engagements, meeting people who, commented or shared this. So even a small essay like this can really make a big impact for people who are in social media, who know social media circles, who know the big websites like Kevin MD, who really amplify the voice of physicians, of healthcare professionals about what are the important things that are happening in their part of the country. This essay made that website, which has got even more type of traction and attracted more attention to it. And I was even interviewed on the Kevin MD podcast to help illustrate that. But probably the most important thing is something that happened locally here. It really, resonated locally here. I walked through the hospital or walked through the stores here, and people came up to me and say, "Hey, we heard about your essay. We believe what you say. We're thankful. We don't know, why there are all those negative people out there." And over the next few weeks, there were people in our community who would bring us lunch or who would show appreciation. So that this is why I do social media, is to really have a big impact in my local community, because I'm telling my story, I'm telling what's going on. And that's something that you can do too in your own communities, to really have a good impact in your community, to share your story, to see what's going on, to try to cut through a lot of the misinformation. So as I close up here, I have a couple of slides left here. As I shared with my last webinar, I'm in a group with a couple other family docs, AAFP members. We are part of the Physician Social Media Ambassadors Program through the AAFP. Basically meaning we are crazy social media people who are on pretty much every social media platform, so you don't have to be. We encourage you to share your story, share your stories of your community, share your stories of family medicine, because we need people to show people what we do, because there's still a lot of misinformation of what family medicine does, what family docs do, and that in your community too. So I encourage you to get that right information out there and to share your story out there. So thank you again. This ends part 2, and I look forward to the next webinar, and I will turn things back over to Kathy here. We do have some time for Q&A, so I will stop sharing my screen and we can do Q&A.
Awesome. Well, type any questions that you have in the chat. We've got one, and it's actually one that I was thinking of and was going to ask you if no one else did. And that's, how do you deal with negative comments? Do you delete them? Do you engage with them? What are your thoughts on that?
Yeah, that is a great question. So so how I deal with them is, I guess, how I deal with them in real life. If the comments, if I get a sense of the comment that they really want to engage, then I do engage and try to address their issue or address their question. If you know that it's somebody that is just slamming you or just want to make a political point or something like that, then I don't engage. Now, I don't delete comments unless it's really egregious, because I found if I delete comments, the same person is going to come back and leave the same comment. So, and what I've seen is, some of my readers, like on Facebook, sometimes they address that person for me, so I don't have to do that. So hopefully you have or start to generate a community who can really kind of police themselves. But if not, sometimes I get in there and I leave a comment for myself, or I'm saying, hey, this is the right CDC information, or this is the right information that is out there. But sometimes people just want to smear you. And, if that's really their goal, then I don't really engage that.
Great. Well, that's the only question that we had. So I want to thank you for being here tonight. Our final webinar is going to be in 2 weeks, and we are going to have some Texas family physicians participate in a panel and talk about how they're using social media on the local level. So I look forward to that. And if there are no other questions, we will give you back a little bit of your evening tonight. Thank you all for joining us. Thank you, Dr. Svilla. This was really helpful. I appreciate you being here.
Great to be here. Thanks everybody for being here.